The average cost of health insurance for a family of 4 without a subsidy costs $833 monthly. To give you an idea of how much money this is, the average household income is approximately $73,000 annually, and $10,000 of this will go towards health insurance. Health insurance should be more affordable in order to make it more available to Americans. More than half of the United States say they cannot afford to pay over $100 a month for insurance. Health insurance contributes to a very large chunk of what's taken out of a person's check. For example, 1/7 of their income will go towards this yearly. People have other things to pay for. For example, if a family of 4 has 2 kids attending daycare, this is $12,000 per child. This means $24,000 yearly for daycare, $10,000 a year for health insurance, which leaves the family with $39,000 a year to pay for their utilities, their house payment, house insurance, car payment, car insurance, and other things. And this is just an example of what the everyday person is responsible for paying. Making healthcare more accessible means more money for people's personal use. This means more people can afford to go on vacations and would have the chance to without worrying about money. It would also mean less illnesses. For example, a mammogram costs $266 out of pocket per visit, according to Van Buren. If a woman has cancer and is unaware, she could go months or even a year before she ever has another mammogram, or until she finds out that she's sick, to be evaluated again. By that time, the sickness could spread through her body, and it could get to the point where it's incurable, or what costs hundreds of dollars to cure before, had they found it sooner, can now cost tens of thousands of dollars to cure, and she may be at risk for her life. Another plus of cheaper health care would be for elderly people. It would help them be able to afford all their medications that they need in order to maintain their health. For example, for every elderly person, on average, they pay $11,000 per year for health insurance. Their health insurance, past retirement age, they're expected to spend $266,000 a year. And for a couple, that's doubled, which means $22,000 per year. And this does not include the cost of medications. For medications to be covered, they have to have Medicare D, which also requires an extra monthly premium. Cheaper health care would also mean less bankruptcies. Last year, in 2016, almost 2 million people filed for bankruptcies due to medical bills alone, according to Hill. This makes healthcare the #1 cause of bankruptcies, which also surpasses credit card bills as well as unpaid mortgages. If more people in our society could afford health insurance, bankruptcies could be less common and would also be less catastrophic to the American people. Health insurance should be more affordable in order to make it more available to Americans. Once again, that means more money for people's personal use, less illnesses, which means people could afford mammograms, and which would keep people from getting cancer. It could also mean heart transplants for people who need them, lower prescription drug costs for elderly people. It would allow them to afford their medications. Also, a longer lifespan because people would not live in fear of going to the doctor. It would also mean less bankruptcies. Overall, our country would be a healthier and happier place because people would be able to live their lives day to day without worrying about the cost of their health insurance.